Hi, my name is Donna Clark, Lead Nurse for Education for Pre-Registration Nursing and Student Nursing Associates and all things pre-registration at SAF. We were first introduced to T-levels in December 22 when we started to look how we were going to introduce them to the Trust. We worked with our partners from trusts across the Shropshire, Telford and Wrekin and with our two colleges to look at how we could introduce T-levels at SAF. We formed a working group which looked at T-levels and how we were going to introduce them into the workplace. We started to look at the numbers that we could actually support, and we looked at T-levels in health within adult placements only in the initial phases of introducing them at SAF. Initially, as employers, we had to look at the challenges that introducing 16 to 19-year-olds in the workplace we may face. So we started to look at our policies, risk assessments, and our education to all our staff in all our clinical learning environments. We worked closely with other partners across Shropshire, Telford and Wrekin to ensure that we all mirrored the understanding of what we had to offer for our T-level students, and we developed a memorandum of understanding so we could share placements and our policies with each other. The partnership working, we learned from others, so we visited other trusts and colleges from across the country because we already knew that they were working in some other places. We learned lots of lessons from them and looked how we can provide ours with the best practice and how we could deliver a good quality placement for all our T-levels and making sure that we get it right from the absolute start. To ensure our T-level students are safe in practice, we had to ensure that the requirements before they came into practices were met. We had to ensure that they had to have a DBS, occupational health, and a standard we introduced was that they all attended a healthcare support work academy. Preparation for practice was imperative to us all to ensure that they absolutely knew what they were coming into, what they can, what they can't do, and also the team around them that can support them whilst they're out with us. So what was really important to us as a practice education team was ensuring that all our managers, our healthcare staff were aware of what a T-level student can do, what they can't do before they came into practice, and what was really important that they all followed a risk assessment pertaining to that particular clinical learning environment. So we spent a lot of time preparing our areas along with our colleges, along with our other partners, making sure that everything was right and in place before they commenced placement. It has been successful due to the actual teams embracing the thought of a T-level, knowing that they're the future of our workforce, knowing that they're actually going to be perhaps starting their career pathway with us. So ensuring that when they got to the wards, they knew exactly what they can and cannot do. One of our main concerns with regards to our 16 to 19-year-old learners in practice was their safety and their psychological safety of what they'd be exposed to at a very young age. It was really important to work alongside our colleges and their parents or their guardians to ensure that they were aware of what their children would be exposed to as well as our own T-level students being aware what they could be exposed to in practice and the support around them. Risk assessments were put in place, shared widely, and ensured that everything was checked before they came into placement, and the support has been heightened on those weeks or those days that they were in practice to ensure they had access to somebody throughout the whole of their placement period. Pivotal and instrumental to the T-levels, to our learners, to us as educators, to our colleges and to the widened Shropshire, Telford and Wrekin working was the employment of the Industry Placement Coordinator, which was Ruth, who's really supported the whole programme since she commenced. We know that it wouldn't have worked so well without that role because she's been pivotal to ensuring that the support for all our learners is there absolutely every week and a key person that we can all communicate to. Communication has been really, really important to us throughout the whole programme and ensuring that, that sometimes if the students are having challenges, problems or sometimes really positive things to say, they come back to us. And equally, if we've got any concerns with any of our learners in practice, that we feed that back to Ruth, who will then go back to the colleges. And the parents can also contact Ruth, so that was important. So we've learned lots around that kind of support mechanism, but the quality of that has been, important to Ruth's role. The success of the T-level programme has definitely been because of our T-level students, their professionalism whilst they've been out in placement. They've learnt lots, we've learnt lots from them. As an education team, we've notably known the embracement of all the the healthcare assistants, our registered nurses, our managers have all really kind of supported them in practice, and they became part of the team very, very quickly. The future of T-levels at SAF, we have successfully placed 33 students in 23-24. We are now looking at obviously providing placements of second year students and introducing more first years from January 25. We've introduced placements in midwifery, and we are commencing AHP, Allied Health Professional placements from September 24. We're also scoping other adult area placements and ensuring that they all get exposure to where they actually want to be. Just to say a massive thank you. The success of the T-levels is down to everybody. Part of the working group where we all started from, our students, our T-level learners, our parents, our colleges. So it's, the success is only going to grow. They are our future. They're our future workforce, and we need to get it absolutely right. We've learned lots of the lessons, and we're going forward with a really positive look on how our T-levels are going to fit within our workforce for many years.